Okay, so I'm going to begin my cranial nerve sensory motor strength assessment. I have knocked, I have washed my hands, I've introduced myself. I did two patient identifiers. My name is Megan Jeffries. My date of birth is 2379. I have described the procedure I'm going to complete on the patient, and I have provided privacy. So the member will feel safe in that all of their HIPAA information is being kept private. And also, I let my patient know that at any time, if they're feeling uncomfortable or discomfort, pain, or just need a break, to let me know, and we can go from that point on. So initially, I would check my patient's level of consciousness. I would ask them person, place, time, date, President of the United States. So I am Megan Jeffries. I'm in my home. The date is August 26, 2020. The president is Donald Trump. And while I was doing that, I would assess my face, the symmetry of when I was talking, if there were any involuntary facial movements, anything like that. And then I would move on to my cranial nerves. Now, the first nerve I'm going to check is cranial nerve 1. That's the olfactory. So I'm going to set this down here. So initially, you would have the patient occlude each side and breathe in and out, just to make sure that they were able to breathe in and out and there was no occlusion. Then you would get a familiar smell. And you would have the patient close their eyes and then occlude one side and then ask them to tell you what they smelled. Cinnamon. Cinnamon. Okay, so that member's cranial nerve 1 is intact. They did get that correct. Next, we would check for nerve 2, which is visual acuity. So for this, I would use a Jaeger card if I had one available, or a Snellen chart, and then I would chart that patient's findings. Also, you would check for their peripheral vision, which you do the fingers outside and tell the patient when they see them to tell you yes, yes, yes. And you would ask them if they see them at the same time. You could check them separately if you felt there was any deviation in either of the eyes to further assess. Okay. Also on the video, it said that you can check the eye and look through the pupil for the, see if there's any papillary edema, check the capillaries, check, what is it called? I think I have it. Cup enlargement in the eye. I do not have that capability, but that is something you would do at that point. Next, we'll check cranial nerves 3, 4, and 6. And this is for ocular, trochlear, and abductans. So initially, I would have the member do the H for the cardinal gaze of direction sign here. So I would go over to the left, follow it with my eyes, go up and down, back up and across, to the right, up and down, and then just watch their eye movement when they're doing that. Then I would ask if they're experiencing any diplopia, which is double vision, and then I would cover one eye and hold up an object, say the number 1, number 2, number 3, and have them tell me what I'm holding up, or it could be an object, and how many of the object to make sure they're not experiencing any diplopia. You would also want to check for any nystagmus or ptosis, which is eye drooping. The ptosis is, the nystagmus is that jerky involuntary movement, which there is none on either eye here. Okay, and then we would check for convergence. So you would hold the finger out and have the patient follow your finger in and out. You watch the eye movements and the pupils to make sure that they could appropriately converge like that. Let's see. Okay, we did that. Then we will check for trigeminal. So this is cranial nerve number 5. So what we would do initially is ask the patient to clench their jaw and then gently press on the chin. Make sure they have that, it's symmetrical and they have that strength. Ask them to open their mouth, and then you press on the forehead and the jaw, trying to close it. Okay, that strength is good. And you ask them to move their jaw back and forth. I feel like one side's better than the other. Maybe I need to get checked out, just to make sure that they do have that capability and strength for that movement. Okay, and then also, let's see. We would next check for the trigeminal, the facial sensation. So we would do where is it? I have broken a Q-tip in half. So I would describe to the patient and let them feel what was dull and what was sharp. So this is sharp and this is dull. So I would have them close their eyes and I would put this around on their forehead and their cheeks and have them tell me what they were feeling. Sharp, 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 dull, 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 sharp, dull, sharp. Okay, and then after that we would check for the corneal response. You take a cotton ball and a wisp of it, and then you hold the eye open and touch the cornea, and it should have them blink and the eye should water a little bit. Do that bilaterally. Okay, and we did get that completed, and all of those cranial nerves are intact as well. Next, we will do cranial nerve 7, which is facial expression. So pretty much we have been observing this while doing the entire assessment on the patient. We've been watching their facial reactions, facial movements when they're talking, laughing, smiling. And then we want to note any involuntary movements throughout this, any tics, ask if they're having any tenderness anywhere. And then, let's see, then you would have them on this part as well, have them close their eyes really tightly and try and open them. Okay, which I cannot do. Then have them wrinkle the forehead. Make sure that's all asymmetrical. Okay, and that is. Okay. And then lastly for this one is the neck muscles. So you would have the member or patient tighten their neck. And you see all these neck muscles, and you want it to be symmetrical. Okay, so that was all cranial nerve 7. Now cranial nerve 8 is acoustic. So you would do the whisper test for this one. So you would stand about 2 feet behind the patient and whisper something into their ear, have them repeat it back. You would do that on both sides and then chart what their response was. Next, you would do the swallowing test. So you could, on this one, have the member have a glass of water, have them drink, watch them swallow. Also, where's my light? Here it is. You want to check for phonation. Well, this is for the swallowing. So you will also touch the back of the throat, check that gag reflex. That also shows that that swallowing sensation is intact. So you do that on both sides. Okay, that is done. Next, we will do the uvula for phonation. This is for the vagal nerve, and this is for cranial nerve 10. Ah, ah, ah. Okay, And then next is cranial nerve 11. This is for spinal accessory. So you want to check the strength of the shoulders. So you will push down on the member's shoulders from behind as they were trying to push up. Show their strength. And then also the head turning. So have them turn into resistance. And that checks for that. And then lastly, this is the hypoglossal cranial check. So you check the tongue, have them stick it out. Make sure it's straight and midline, and maybe have them wiggle it a little bit just to make sure that it does move symmetrically and the strength is good in the tongue there. Okay, next we'll move on to the reflexes. So I made my own little handy dandy hammer here. So first we will do the tricep. So you hit the member's tricep back here. And it should cause some type of reaction here. I think I have a little extra weight. It's not getting through, but I do feel kind of a tensing in my muscle area and a little bit of reaction to my fingers. So that is intact. Then we'll do the bicep reflex. So you'll hit in this area here. And typically you'll have one finger there and you tap that finger, but I can't do it like that on myself, but I'll just tap it here. I do feel the tightening, and my fingers do curl up a little bit, if you can see this. Okay, that is intact. Then we'll do the brachioradialis, which is on the side here, and you want to do, I think it's at about 2 centimeters up. Okay, that did cause a slight reflex in my hands, so that one is intact. Then we'll do the patellar. So let me move this over here. Okay, actually I'll hold it for the patellar. Okay, so you want to find the patellar bone. You have the member sit with your legs dangling comfortably. Find the patellar bone, and then the area in between there with the tendon. Okay, and you'll tap it. And you should see that movement of the foot jerking and kicking. All right, and then the next one will be the Achilles. So you have the member cross their leg, and you hit the back. You support their leg a little bit. You hit the back here, and you do see a little bit of tightening in that calf muscle. Okay, that is a good positive sign. And then we'll do the plantar last, which, sorry, I did some earthing today. My feet are a little bit dirty on the bottom. Okay, so this one, let's see how it is. Okay, so you take this up the member's foot and you monitor their toe reaction. There's none, so that's normal. If you were to see a positive Babinski sign, which is not normal for adults, you would see the toes spread out and extend, but you want to see a nice, calm toes for this one. So that was a regular plantar reflex sign. Next, we will do the finger to nose test. So you have the patient stand in front of you, and you would hold out your finger. They touch their nose to your finger, and then you would move your finger to many different spots. Make sure they could do that coordination with hand, eye, and finger movement. And then next would be the heel to shin test. So you would have the patient lying on the bed. I'm just going to do it this way. Lying on the bed, and then you have them cross their heel to their shin and then slide it down their shin. And then you would do it on the opposite side just to make sure they had that coordination. Okay, and then lastly is the Romberg test. You have the patient stand with their feet together, their arms down at their sides, and have them close their eyes. And you want to assess for 20 seconds. A little slight swing is normal, but if the patient has to take a step forward or kind of stumbles, then that is a positive Romberg side. Okay, so do this for 20 seconds. Okay, we'll say that's 20. So patient did fine. Next, we would do the grip strength test. I would hold out both my hands with my fingers like this and have the patient grip my fingers at the same time and squeeze as hard as they could. This would show me if they had equal strength on both sides and then also what their strength level was on each side. And then next, we would do the dorsiflexion and the plantar flexion test. So you would do the members laying on the bed, and then you would ask them to, let's see if I got this. Yep, flex their foot up like this, and then you would try and push against them this direction, and then push against them in the opposite direction. And then that would be rated like 5 out of 5. 5 out of 5 is the top. Okay, then we would do the dull and sharp sensation for the legs and the arms. Again, I would use this Q-tip, and I would do it in about 4 areas of the leg and ask them to tell me what type of sensation and just to tell me when it is occurring. Sharp, sharp, soft, soft, sharp, sharp, soft, soft, soft. And that was, again, bilaterally to both legs as well. And then lastly, for the sensory testing, we would do the finger and toe test, position test. You would have the patient close their eyes, and you would have to do 1 finger on each hand, 1 toe on each foot. And so you would have them have their eyes closed. You would move a finger and then ask them which finger and what position. So this would be my left middle finger, and it is in the upward position. This would be my right pinky, and it is in the upward position. And then you would do 1 toe on each foot as well. And that would complete our assessment. Then you would just make sure that the patient was comfortable, all safety was in place for that particular member. Everything they needed was within reach, and thank them for their assistance with the assessment. Ask them if they need anything, and then wash your hands and leave. Thank you.